We could always ask the board for approval to wait another couple of minutes if you want to. Just,
We don't know if you guys can. Would you like to wait a few minutes?
just providing you an option that
Yeah,
that's in your purview.
well, I think we need to start with public comment, but I don't know. We can start it with public comment anyway. All right.
Can we start with the quorum?
Yeah, we can start. We really shouldn't have any, certainly we can't take action, and we shouldn't really even have discussion. But we could
can
have,
listen to public
we can
comment.
listen to public comment, we could have you present,
Okay.
but we shouldn't
Alright.
have a discussion about it
Would you,
without a quorum.
member announcements also?
Yeah, I think we can cover announcements.
Okay.
8.
Eight.
And we've got 7.
Great. Okay, I am calling the meeting to order.
But I'm sorry, before we, on the quorum issue, does Nikki, is she
I don't think, Christina, she's not.
excused?
participating.
Is she participating as a board
Did
member?
not receive a request for an excuse.
Okay.
Like I didn't see one come through to.
She should be participating as a public participant,
Yeah.
which means she can't weigh in on vote or contribute to quorum.
Okay.
But we have to have a physical quorum anyway.
No, we don't have that. There are exceptions where people can be part of the quorum remotely, but there's a process. Instead of like if you're sick or if you're away for business, it has to be for business. But you have to like post things and it's kind of complicated, so.
But about to change.
Oh, right. Sorry about that.
So the first time I said I was calling the meeting to order, did that call it to order, or do I need to call it to order?
I already noted it.
Okay, we're in order. All right, let's start with public comment. I'm gonna read the little blurb here. Members of the public are welcome to speak either in person or over Zoom. Speakers are not required to identify themselves. In compliance with the Brown Act, no action or discussion will be undertaken on any item raised during the public comment period. Board members may ask for clarification, refer concerns to staff, and/or request that an item be placed on a future agenda. There will be multiple opportunities for public comment throughout this meeting. So starting in the room, do we have any public comment?
Yes, my name is Gabriel. Congratulations to Tony Kildare for being promoted, I guess, to Debt Director.
Thank you, that's very kind of you.
And I'm not sure what this meeting, the agenda is about, so I don't know what to comment on.
You can comment in general about mental health issues in Yolo County.
Okay, I've never really had mental health issues, but I will listen to the agenda and then I'll comment.
Okay, we'll have another period.
I really don't have
Later.
any, I've never had a mental issue, but I'll listen to the agenda and give my comment and opinion.
Okay,
So that, I'll close out that.
all right, sounds good. We'll come back to you when we do the next public comment. Okay, so anybody who's online, do you have a public comment?
Yes, I do.
And I'll just mention before you start that we now have a quorum, but go ahead.
Okay, thank you. My name's Donna Neville, and I serve on the Nami-Yolo County Board. I'm sorry that I couldn't be there in person with you all this evening, but I wanted to at least come here and thank you all so much for those of you who came and supported us on September 27th at NAMI Walks. It was a great success, and it was wonderful to see you there, and very appreciative to those of you who were able to come out and support us. So thank you very much. We also want to thank you for the support that you've provided to us as we've continued to advocate for funding under our contract with Yolo County. We're deeply appreciative of that. And finally, I have some really good news. I mean, you'll notice that I am not Jen Boucher-Danzer, who's normally at your meetings, but she has, as you know, moved on to a different position in NAMI, Oregon. But we're happy to announce that we do have a new executive director. Her name is Lou Eng, and she'll be officially on board next week. So you'll be meeting her very soon. And she comes to NAMI with Nami-Yolo County with lots of really great experience. She's previously been an executive director at another NAMI affiliate, and she's most recently worked for NAMI California. So we are all really, really excited to have her on board and to be working with her. And I know she will look forward to coming to your meetings and meeting all of you. So thank you. Those are my comments for this evening.
Thank you, Donna. That's great news. Do we have any other public comments? Okay.
I'll go ahead and one more.
Okay.
Present myself, my name is Gabriel Guillen. I've been a community member my whole life, 51 years here in Woodland. Hello everyone again, my name is Gabriel Guillen. I've been a member of the community for 51 years. The past year, a homeless member of the community, and I do have a lot of comments on that issue. You know, there are a lot of mental people that need mental health conditioning out there. That's about it for now.
All right, thank you. Okay, moving on to approval of the agenda. Oh, I'm sorry, did we miss something? Okay, approval of the agenda. Do I have a motion to approve the agenda?
So moved.
Second, Jonathan? First, Chris?
All in favor?
Aye.
Anyone opposed? Approval of the minutes. A motion to approve the minutes?
So moved.
Do we have a second? All in favor?
Aye.
Anybody opposed? Member announcements.
Okay, last Monday, or 2 days ago, I was able to attend the mental health court graduation. Program still now taking people again into it. I did bring a copy of the graduation essay for an individual that successfully completed that program for any member that wants to read it. I have her permission to share, and I agreed to remove her name from the essay. So if someone wants to read it, I have it available. There'll be 2 more mental health court graduations coming up. One will be October 27th at 2 o'clock in Department 5. The next one will be November 7th at 2 o'clock in Department 5. And then we have a double addiction intervention court graduation on November 21st at 2 o'clock in Department 6. If you ever want to get the notes or whatever, give me a call. If I know about it, I'll let you know if you're interested in attending. They're very positive events. I attended the Opioid Coalition meeting last month. Communicare is having a Dia de Muertos celebration from 5 to 8 p.m. on October 24th at the Hanson Family Health Center at 215 West Beamer Street. It's open to all ages. Communicare LA is our partner, provides a lot of the outpatient addiction treatment, and a lot of other services community-wide. One of the things I learned at the Opioid Coalition meeting is that since 2017, there have been 7 overdose deaths that involve a substance called Kratom. It's also been referred to as this gas station heroin. 2 of those deaths were just Kratom. 5 of them were mixed with other substances. And apparently you can get Kratom basically, legally, different places. Gas stations is one of them. There's drinks you can buy, it has other ways of getting it. Some jurisdictions in the state, some states have outlawed it or made it only where it can be purchased by someone who's 21 or older. And so that might be something as a board we might want to look at. My big concern is if you have juveniles or minors who get their hands on this, could be dangerous. Other than that, I want to congratulate NAMI and put on a great event for the NAMI Walk. A number of us attended. Sue, I saw you were volunteering there, so I want to commend you for that.
Next to
And Kimberly, okay, I missed Kimberly, I'm sorry. But for all those of our board members that volunteer, I thought that was really great. I may have to join you next time. That's all I've got.
Is it possible to email the essay so that we can read it?
I can do that. I've got a number of copies I can hand out here too.
Thank you. Does anybody, do any other members have any announcements?
I do. This is Jonathan. A couple announcements. I'm losing track of time here, but Last week, I went to a Words to Deeds conference in Los Angeles. I was actually sent or funded to go by Cal BHBC, which is our statewide association for local behavioral health boards. I'm on the advisory committee. It was really interesting. There were a number of presentations. We got to see what counties are doing in behavioral health, with everything ranging from CareCorp to SB 43 to Prop 36. One county that really stuck out in my mind that is doing some really amazing things, especially since it's a small county, is Lake County. Their mobile crisis, really doing some amazing things in Lake County, and they have this. The behavioral health director is like the ever ready bunny. I mean, she's just go, go, go. And it's really cool hearing what they were doing. I also this week, last Thursday was in in Long Beach. I was asked as part of my role at the DA's Association to be on the panel on Prop 36. So California League of Cities represents all council members, so mayors and council members. So there were about 2,000 in attendance, and they had breakouts. So the Prop 36, not everyone went to that because there are a lot of different breakouts. So I sat on a panel with the chief from Riverside, the chief from Santa Ana, and the behavioral health director from Orange County. And they're really making a lot of progress with 36. But one thing I will say from what I've seen and from listening to others is there's a lot of inconsistency in terms of the success of counties with Prop 36. And certainly funding is an issue. And one of the things that came up is the behavioral health director from Orange County said that they are using the opioid settlement money to fund Prop 36, which I thought was interesting. And I was going to call him, do you know Ian? His name's Ian. He's the behavioral health director at Orange County. So that was interesting to hear. So, and that's all I have. Did we announce that, last time I was asking Chrissy, thought we did that, I think we did actually, that mental health court is now again accepting referrals. They've reopened. I think
I just mentioned it again.
Yeah, right, okay.
Any other member announcements?
Hello. Okay. I created a draft of a new member guide. So I compiled a bunch of documents from the California Association of Local Behavioral Health Boards website, and then also some other documents such as like the Rosenberg's Rules of Order summary and then the Brown Act PowerPoint summary. So my hope is that we can have a binder that we provide to new members that kind of helps onboard people and orient them to what the board does, our procedures, what's our scope, things like that. I already forwarded that to Christina, and she should be forwarding that to like all of you prior to next meeting to review. If you have anything else you'd like to suggest is included in that, like I'm happy to add it, but yeah, just wanted to update everyone on that.
Okay, great. Any other member announcements? Oh, thank you.
Hi, I'm just seeing that somebody has apparently cloned my email.
Oh, it's not you?
So no, anyway, what I wanted to tell you is that the Yolo County Health Commission Health Council has expressed an interest in having someone come and explain to them what is happening with Crisis Now and what the alternate arrangements are for providing those services, even in the face of reductions in budget cuts. So I just wanted you all to be aware of it. Tony, I wanted you in particular to be aware of it in case you had not gotten the word yet. But you may be asked to come to a future Health Council meeting and, I think they've already gotten the sense that it's not happening, but they're concerned because they were really excited about it. So,
And Nikki, you're our representative to that.
yes, yes, I have been, unless someone else wants to do it. They meet from 9 to 11 on the second Thursday of every month.
All right, so I just.
And Maria was my alternate, but, you know, I'm certainly happy to have someone else do it if you wish.
Well, I'm not volunteering, but it's up to everyone to see if somebody else wants to do it.
I could volunteer to be an alternate.
Okay, okay,
Nikki, I could join you once also. I can join you, check it out.
okay.
The one-
Please do. I'll send you, when I get the notice for the next meeting, I'll send it to both of you. And, you know, you can sit in and see what it's like. It's, you know, they really do want to make an effort to include mental health issues in the overall health issues of Yolo County, which I think is fabulous. And some of the things that we talk about, like the impact of vaccination on people experiencing mental health crises during COVID, and some of those other kinds of things are actually quite, you know, quite interesting.
Once we had a joint meeting with them.
We did.
Yes, we did.
You might want to.
And they wanna do that, you know, on a much more regular basis than we have in the past.
I think it'd be interesting if we had common topics.
Yes,
We talk about, I think the tour went to Sacramento with that, I forget what that treatment was. Tony, help me out here, the one with the depression.
ECG.
I think that was, a presentation on that might be helpful. With a joint health commission and local behavioral health board meeting, just as a topic.
Yeah, I think on a broader note, it's relevant for us to be aware of what other boards and commissions in the county are doing, because just anecdotally, I'm talking to some members of like the health council, there's a lot of common interests and a lot of awareness of common
Yes.
issues, but then there's not like cross communication between boards on like issues that concern all of us, so that's.
Don't we have the cross-pollinating across local behavioral health boards existing already? It's
What do you mean?
the one that we can attend that, I don't know what the formal term is, but I think you present at them from time to time.
You
It's
mean,
where all the counties come together and talk about all the local behavioral health board issues that they're experiencing.
do you mean the Cal BHBC?
Thank you.
Yeah,
Yeah,
yeah.
and so what Kim was mentioning was that we don't have that opportunity, but I think that's the forum where all counties come together and have an opportunity to share mental health specific issues, concerns, and various processes that govern how we do the work for our respective counties.
Yeah, what I'm talking about is kind of within county.
Oh,
So us and Health Council, us and Opioid Coalition, us and like, I think there's a commission about EMS
got it.
or medical care, so,
Okay,
yeah, I'm talking more about within county, but yeah, your point, to your point of collaborating with boards from other counties, that's already happening.
Yes,
throughout
yes,
the CC. The networking is really great, because, and again, anecdotally, like talking to people at Cal BHBC during trainings, there's a lot of common issues between counties, and then we kind of can see how different counties are dealing with the same issues, and then kind of, yeah, just learn about that.
The other thing I wanted to mention, and I'd appreciate it if you all would still use these, because my hearing is not back to normal yet. I'm still wrestling with the audiologist. At any rate, the other thing I would like to see, and at least an update in, is the intersection between children's services and mental health. I feel like we spend the overwhelming majority of our time thinking about adult services. And I think we need to, at least periodically, keep track and keep up with what's happening in the children's system of care.
Yeah, we're happy to do that. I think that, are you talking about when you talk about the intersection with children's systems and behavioral health, you mean child welfare specifically, or you?
Both child welfare, when there's a child welfare components often engage behavioral health services and need to. But in terms of not so much child welfare, but the children's system of care for behavioral health in the county. I don't feel like I have a good grasp of how it's delivered, how do parents recognize symptoms, what we do to try to make parents aware that the county has these services and that kind of thing. That's all.
Would you like to include that as an agenda item for a future board meeting, or would it be something we would like maybe in next month's director's report, maybe a little bit more comprehensive overview, an opportunity to discuss at that time?
Right.
There is a children's system of care update in here, but it doesn't get into all the weeds maybe.
Right. So I'm thinking of something a little bit more, a little bit deeper dive than that.
Okay.
Okay. Great. Any other member announcements? All right, the next item is chair report. The chair is not here. I do not have a report, but I do want to take this opportunity to formally congratulate Tony on becoming permanent. And we have cupcakes here if you'd like any celebratory cupcakes.
You are all too kind. That was unnecessary, but thank you. I'll have a cupcake.
All right, Supervisor Frericks asked to speak right after the chair because he needs to leave early. Supervisor Frericks, are you available?
I am, yeah. Thanks so much, Madam Chair. Thanks for pinch hitting tonight. It's good to see everybody. You're unfortunately very tiny on my screen, but I can make you all out. I just wanted to, apologies, I have to leave a little bit early tonight at about 7 p.m., so not going to be able to stay for the full length of the meeting. But wanted to just give you the quick update on a few items. Firstly, just on the MHSA and the BHSA item, that's coming up next week, unfortunately, on the 21st, so we'll talk about that in a second. But I just want to 5 kind of quick items for you. So the Board of Supervisors took action on the 25-26 budget at our September 23rd meeting. Staff had identified an additional little over $96,000 in unused funds from board-directed projects that came in under budget. So the board approved reallocating those funds to support the mental health budget in this coming fiscal year 25-26. Not nearly enough, but helpful, certainly. The adopted budget that we just voted on September 23rd did not include any reductions to the mental health budget. And however, we will again consider potential reductions and budget adjustments at the October 21st board meeting. The board expressed interest in preserving some fund balance. So given the level of funding shifts anticipated, there is definitely a preference to avoid exhausting the entire fund balance in the 25-26 budget. But this approach will help, I think, allow additional runway and preserve some fund balance to help address additional anticipated reductions in the 26-27 year. But it gives a little bit of runway for our partnerships, our community partnerships that we have with, like, for example, the K-12 schools partnership or the work that NAMI YOLO does. There's work that First Five does as well. It gives a little bit of additional time to sort of absorb some of these potential cuts. The board also expressed interest in accurate outcomes data to help us better understand the effectiveness of existing programs. That is something that you all directly spoke about previously as well. And so want to make sure that we that we raise those issues at our board meeting. Despite the state directive vis-a-vis Prop 1 to move away from funding prevention activities and focus more on the severely mentally ill, we need to continue to fund prevention programs, if not directly, then by advocating for additional funding to do so. I think that's just so important. That's my personal opinion, certainly, but I think that others share that opinion as well. And then in the midst of difficult but necessary budget reductions, there are definitely opportunities for revenue increases as well. So such as increasing our Medi-Cal billing. While this is going to take some time and sort of in some investment in infrastructure for the county, this is one of the tools at our disposal for the longer term sustainability of our mental health funding needs. So the county is currently not billing very much for Medi-Cal reimbursement. And so that is something that we should be doing more of, and that the board is very supportive of us doing that as well. And then just lastly, I know it's been mentioned a couple times already, but just so good to see so many of you at the NAMI Walks event. And, that raised over $60,000 for NAMI YOLO. So just thanks to everybody who participated and helped spread the word and or volunteered and or donated. So thanks so much. Those are my items for you this evening, and happy to try to answer any questions you might have now.
Are there any questions? I don't see any questions. Thank you.
You're welcome. Thanks very much.
Okay, moving to the next item. Unfortunately, we have correspondence. Christina, do you want to share the correspondence?
We did receive a letter of resignation for Maria Seamus, and it will be effective in December. December will be her last month. So you're all in favor.
Okay, we're back to public comment. Anything from inside the room? Anything from online? Okay, I guess we're ready to move on to the data notebook survey document review. And we have guests for that?
We have Mario
Mario's
Galliani, who's a clinical manager for the adult behavioral health program. He oversees our access team. That's basically the front door and oversight of the wellness centers as well. And so he's here today to provide a brief presentation about the data notebook and to maybe help answer any questions you guys might have about that.
Could you lay out the room for
Bring you a microphone, man.
Awesome. I see a few familiar faces here. Chris, Jonathan, Simon, of course, Christina. And we've met in the past with Sierra Vista Heritage Oaks campus tour. I don't quite have a presentation prepared. I was just here to respond to further clarification of the data notebook submission that was provided that I didn't have, full transparency, a chance to fully review and edit when it was sent forth. So I'm glad to share, expound on any questions. That was my understanding. I was here to provide some clarification. I also have some calendars for our 3 wellness centers to just pass around so that you can see some of the clinical groups as well as peer support.
Mario, can you speak closer to the mic?
Sure.
Thanks.
I have some calendars here for our respective wellness centers to show some of the activities, the clinical groups, and the peer support through certified peer support groups that we provide our consumers.
That's the one, that's on the floor. See if that's one.
Testing, 1, 2, 3.
Yes, much better.
So, pass these around right now. Let's take a look. I have them up for everybody. Okay.
Oh.
The green one's over here.
Okay.
We talked about number of this.
Fancy pilot.
Yeah.
Really got, it does today, right?
That was today. Not anything of the outing today, they got to go to Apple Hill and experience that. Fortunately, the weather was not the greatest, but at least it was rain.
Well, at least you didn't go yesterday.
True.
May I get one of those was Sacramento calendars, please?
I like the festival.
Thank you.
Yeah, well, I can't take credit for that. Our program coordinator for the Wellness Center, Sabina Kish, who couldn't be here today, has the creativeness, festiveness. But so again, I was prepared to answer questions, but since I don't know if there's any specific questions, maybe I'll just go through the data notebook and provide some of the responses that are a little bit feathered out further than the initial submission. So obviously, the name of our county is Yolo County. We have 3 wellness centers, the main one being in Woodland. Unfortunately, we had to shut down days and times in our 2 outside other clinics, I should say, Davis and West Sacramento. We were open several days a week, 5 days a week for all of them. However, due to staffing issues and budget cuts and things of this nature, the Wellness Center in West Sacramento is open 3 days, as well as the clinic, Tuesdays, Thursdays, Fridays. And the Davis Clinic and Wellness Center is open Mondays and Wednesdays from 9 to 3, from 10 to 3. And then the Woodland continues to be open 5 days a week, 10 to 3.
Does the Woodland one have more people showing up, which is why that's open 5 days a week? Or what was the rationale behind one city having 2 days, one having 3 days, one having 5 days?
I think you're right on with that, Chris, that, there's more of a census that happens in Woodland as compared to the clinics in Davis and West Sacramento, just overall, not just for Wellness Center, but clientele as well. We do not at the moment have a clubhouse model program. I know that that's been a discussion that we've been having over time, and that may be something for the future that we may be leaning towards, but at the moment it's not a clubhouse model program. It is operated by county staff. We have peers with lived experience in both the SUD and mental health world, so behavioral health, as well as certified peers, as well as a couple of behavioral health case managers and the program coordinator who also a behavioral health case manager. Operated by the county, it's not nonprofit, and we're not part of another organization. Thankfully, no NIMBYism. Our wellness centers are within our clinics that have been around and established and well known as to the services that we provide our clients. The person to contact directly for everything Wellness Center information after this, if need be, would be Sabina Kish, the program coordinator. Provided her email contact information for follow-up if need be. We don't have a board of directors. And at the moment, the participants are not, there's an inclusion in community planning activities, such as the integrated plan for behavioral health department. However, our peers have a lot of involvement in planning, design, programming. It is certainly based on a recovery model, a drop-in model as well. And Folks that are welcome are individuals that identify having mental health needs, as well as substance use disorder needs. The model that more or less we follow is a psychosocial rehabilitation model. And funding sources would be county, Medi-Cal, was MHSA, and moving to BHSA. We don't operate as a larger organization that is not county behavioral health department. The supervisor or program coordinator openly shares that, yes, she does have lived experience. And all of the peers have lived experience in one respect or another. And the two case managers also have lived experience. And one of those case managers was previously a peer support worker that stabilized over years and promoted up to being a behavioral health case manager too. In terms of utilizing volunteers with lived experience, we do have staff with lived experience. They're not volunteers. Some of the staff are now certified peer support workers who can draw down Medi-Cal reimbursement for individual and or group peer services. In regard to, does the program utilize other volunteers such as family members or people with lived experience? Yes, several of the peers happen to either have direct lived experience or be family members of folks with lived experience. And we do, but they're staff, but we also do have volunteers that come in to provide various groups of different nature.
Wait, did you just say the answer to 22 was yes?
We do utilize and include folks that volunteer their time to come in and run various groups now and again. They're not the ongoing groups that are provided by peers or certified peers or case managers, but special sort of groups, events that we can get together, and those would be through volunteers.
Some of the responses have been updated, I noticed.
Oh,
I'm gonna
okay.
track them and then I'll meet with
Thank you.
Mario and make sure that I get you guys a new
Yeah.
updated data report for submission.
Sorry,
Yeah,
that's what
that's
I
okay.
meant about. I was going to further cut around some of the responses that were sort of yes and no and cut and dry.
Thanks.
I apologize for that. Yes, we have both certified, number 23, we have both certified peer support specialists and non-Medi-Cal certified peer support specialists. And all of those folks have the opportunity to, if they meet criteria, the limited criteria, to move on to training through DHCS and move forward with testing. They have the ability to do that, and we support that and reinforce that. We do have drop-in participants. We receive referrals from the county in terms of psychiatrists, clinicians, providers in their assessments, psychosocial assessments, psychiatric assessments, provide recommendations and referrals to the center if that's something that would benefit the client, which I think it would benefit any individual. Other organizations that we may receive referrals from would be the local shelter, the police and sheriff's department, law enforcement in general. Usually it's the homeless services coordinators and local nonprofits, local healthcare facilities. And then with respect to satisfaction surveys, these happen regularly on a quarterly basis. And regarding the story of brief success, just more of a general assertion that several longtime consumers have built strong social support network through staff and peers. Many have achieved long-term psychiatric stabilization and are now working as extra help peers. Others as certified peer support workers that can bill for services and draw down Medi-Cal reimbursement. Other former peers that have worked in the Wellness Center for a significant time have moved on to other supported and conventional employment after their 10 years working with HHSA Wellness Centers. So that's what I have to clarify for y'all. And if you have any specific questions that I could try and answer, I would be glad to do so.
I have a question.
Sure.
I'm just curious, like, what is the average participation rate that you have, like, on a monthly basis? Let's say for Woodland, we can start with that. Would it be like 25 people or 50? Like, how many people went up to Apple Hill, for example?
That's a great question, and I wasn't part of the field trip today. I was caught up with some meetings. I think we had probably between 20 and 25. The issue is always tends to be transportation and having enough staff to be able to support, all the vans to getting to where we have to get. So that's basically the limitation. Otherwise, we'd love to have everybody come possibly. Today was Apple Hill. We have a yearly wellness center picnic that typically gets other counties connected with us and have sort of like a social mixer. So either Sutter, Solano, Sacramento, at different times, different years we've had. Also the state fair, the Yolo County Fair, and a lot of museums and things of this nature out in Sacramento, Van Gogh display, exhibition, things like that. As far as the census in Woodland, I would say it depends on the day. Some days we offer a breakfast, which is always a big census day. Other days we offer a warm lunch. In between those days, we have snacks and little snack, meals that we prepare. So those food days are bigger days. Outing days are bigger days. But I would say in Woodland, we have an average of 20 to 25 clients that come in 30 daily, give and take throughout the week, maybe a little bit more, a little bit less. The census in West Sacramento being a smaller clinic and less availability there in terms of the days of the week, probably 15, give or take a little bit on a daily basis. And Davis, it's probably between 20 and 25. We have a good participation there with Pine Tree, east and west. We're geographically desirable nearby, and we try our best to provide transportation in conjunction with their transportation, whether it's them bringing them and us taking them back, or vice versa, or somehow sharing sharing the wealth.
Thank you.
Do you have hot meals at all three cities, or?
We do. The one unfortunate aspect is that we used to have a lot of availability with food in terms of being able to provide food bags to help individuals tide them over the weekend, sort of thing. But we're still working on that. We had a sort of a difficulty continuing the process that we've had for years going on with the Yolo Food Bank. So we're looking at creative ways to try and get back with that dynamic so that we can have food bags for folks that are in need. We serve all of our HHSA clients, of course, so they could be FSP clients, they could be regular access team clients, and we also are have been open to individuals just in the community. So we have a lot of unhoused folks that come in and engage in our services and use our computers for various things, for looking for job type situations or connecting with resources in different respects. Yes, ma'am.
How long have you had the programs in Davis and West Sac?
So the program in West Sac has been around for several years. There was, as some of you folks may recall, an urgent care.
Yes.
And so I think it was right after the urgent care
Okay.
that we implemented the wellness center. And in Davis, it was formerly the Tay Wellness Center.
Okay,
which
that's
is,
what I remember.
Yeah, an amazing spot. And then the Tay program was contracted out in terms of FSP. and they had that wonderful space, but it belonged to CommuniCare for that time. And they had sort of a day drop-in center, and so when CommuniCare navigation access point went away from the Davis Clinic, we opened that back up when we were, at 2 days a week, and then opened up to 5 because we had such a census coming in regularly that we were able to open it 5 days a week, 10 to 3, excuse me.
I just wondered, because when my family member was alive, he used to come here. I mean, I would drive him over to Woodland, or sometimes Glenn would come and get him and take him to Woodland to come to day treatment. And I thought it was really valuable. It gave him something to do other than sit around and obsess about what he didn't have or what he couldn't do, or.
I agree. It's social stimulation.
Yeah.
Self-help groups. They develop, a lot of these folks network amongst themselves that they can generalize outside when the wellness centers are not open, on the weekends, after hours.
They also really, what I heard from a number of consumers was that they really liked some of the movies. You would.
Yes, Thursday is a popular day because of the hot lunch, but also we have movies that are played in the wellness center.
Yeah.
And folks come from
Yeah.
from different cities, across the street, from next
Right.
door. Yeah,
To come to those, yeah.
absolutely.
I'm just curious, how are staff equipped to work with someone who comes in a crisis episode?
That's a great question. We do have our peers go through trainings, just like all of our other staff, so training in de-escalation, things of that nature. We also have crisis support within the clinic if things escalate to a point that, maybe it's a little bit over the top for peers in the center, then we, right very close by, have a outpatient crisis clinician. We have a crisis clinical manager in the clinic, and we also have our 2 Woodland crisis co-responders that are around in the field that can respond quickly as well.
I'm curious, do the staff and/or volunteers receive any clinical supervision?
They do. The certified peers receive supervision through a lead clinician on our access team, as well as with me. We have a weekly peer support meeting where we staff cases, situations, trainings for those peers.
Thank you.
Sure.
You brought up that supervisors, peers, and volunteers all identify as people with lived experience. So there's kind of people in that category at different levels in your program. But I'm just kind of wondering, what kind of lived experience do these people have? So is it more people with lived experience as consumers, more family members, or certain diagnoses more common?
It's a combination of all of that, but SUD, lived experience in recovery, obviously mental health, lived experience, and in recovery or currently in the process of being in services and stabilizing to the point that they're able to apply for a job like this and be hired. So all of what you mentioned, a little bit sprinkled about.
Okay, yeah, because something that I've noticed is that sometimes certain groups are overrepresented or underrepresented in terms of what's labeled as a peer or a consumer. So there's certain diagnoses that are overrepresented among consumer peers, and there's often family members are overrepresented when in kind of environments where people are being labeled as peers. So I was just kind of wondering what the dynamic was within the wellness centers.
Yeah, we may have 1 or 2 folks that are staff as a result of, that are peer consumers as a result of being a family member of somebody. Everybody else is, for the most part, in our services or in services with partner agencies in the community for mental health or SUD.
Yeah, Kimberly, are you asking maybe for clarification about individuals who may have lived experience as consumers of mental health or substance use disorder services, like what their diagnoses are.
Or just what are, I guess, I'm just kind of looking at like general trends. I'm not asking about anyone like specifically, because for example, like, this is just anecdotal, among NAMI, a lot of the people that self-identify as pure consumers say that they have depression, for example, but then there's less people representing like psychosis spectrum, like in NAMI advocacy groups that are pure consumers directly themselves.
Yeah, I think that part of the challenge really is just due to that we don't have a tremendous amount of staffing, right? And so I don't think we would want to, it would be really difficult for us to pinpoint that down without, I mean, it's not necessarily a confidentiality issue, but I mean, it's like more of a matter of like respect, not to put people's business out there, I think, but to your point, I understand what you're saying. And I think that we always do our best, right, to bring in peers and case managers and staff who have lived experience, but we can only work with the individuals who are making themselves available and who are appropriate for that role, right? So, it's kind of hard for us to like actively go out and seek someone maybe who has a particular diagnosis or is being affected in a particular way, just to meet a need. But to your point, I understand what you're saying, and we're sensitive to that. But again, we're working with the individuals that are available to us at any given moment in time.
What I can say, to keep it general, to reframe that, is that most of our staff are county consumers, and the demographic that we serve at HHSA is SMI, severe mental illness. And we have some folks that come from the outside, community providers, mild to moderate growth.
Okay. Yeah, I'm just kind of wondering in terms of general trends, because just anecdotally, I do see certain groups overrepresented in certain environments, so.
And I appreciate that. I'm not really sure how to respond to it other than to say that that is definitely something we will keep an eye on, as time goes, as we move forward with things. But I think that some of that, there may be a certain amount of that that's unavoidable, right? Just depending on the individuals that are making themselves available for that at any given point in time. But thank you.
Can I ask another question? Does funding determine how many people we're serving? Like my area is West Sac, and so you said there's about 15 people, but there's been some budget issues and lack of staffing, like you mentioned. So, I mean, are we going to maintain that? Is there a possibility to maintain that, or as the budget cuts happen, or is it going to be like we're going to be serving less people, or in time, are we going to be able to serve the same amount and more people? Because we have a lot of people in my area that need services,
Sure. I don't believe that it limits the clients that are able to come in. It just puts a little bit more of a burden on the staff to have more caseload, so to speak, the drop-in caseload that comes in day to day.
So the days that were reduced, those more days,
So-
we're going to pick back up again, or are we going to just stay with those?
So to your point, yes, obviously funding is going to impact our ability to provide services. And so we had to reduce the number of days that the other clinics were open because of funding reductions. And I can't speak conclusively one way or the other than to say that, we are looking at potential budget reductions, moving into the next fiscal year. We're looking at potential budget reductions for MHSA that could potentially impact this. Now, these are a different type of services than traditional behavioral health services, in the sense that it's more of a peer model, right? It's more of a socialization model, and you can have a reduced staff to client ratio, right? You can even operate like a clubhouse model, which is like a purely peer model, or almost purely peer model, right? So the good part about that model is that we can have a larger number of individuals who can be served on any given day. It's just about, how many days we can operate in specific sites. So, in one sense, yes, the budget is going to dictate the overall ability to serve individuals in all 3 sites on any particular day. But the other part really has to do with the degree to which the community knows that the services exist and the ability of individuals to get to the locations.
I just wanted to mention too that it's the winter months. We talked this time last year about how people go into depression and that kind of thing. And so I just hope that we have services in Wetsac as well and that people are covered, especially with the cold weather and that kind of thing, and being able to get some hot meals. I'd be willing to volunteer to go out there and try to get some food if I have to. I don't mind at all. If you need a volunteer to help with that, I can do a
That would
sales
be
pitch
wonderful.
somewhere. Yeah. Okay, thank you.
That was actually my next question. Thank you, Melanie, for bringing it up. I was going to ask, are there times of the year that these adult wellness centers observe higher use? So like I'm thinking the winter, when it's colder, people want to come indoors. Or maybe even in the summertime when it's hotter. Is there a higher use trend?
Yes, I think you hit it right there. In the summer months, we're very hot and people need respite, and the reverse in the winter. So I would say, generally speaking, there's a little bit more of folks coming in that are the unhoused folks during those times of the year.
Are there any partnerships that the Adult Wellness Center program is considering forming? I'm thinking about maybe churches that can help offset or some other community-based groups.
We've been in discussions with that over the months as a result of some of the changes that have happened with the budget and the food bags and distribution that I was referencing. But nothing tangible at the moment. We're just still sort of navigating that.
I guess finally, I wonder what role community groups like Rotary clubs might have to help fill in any gaps.
We do have some involvement with the ELF Rotary program, but that so happens to be over the Christmas holidays, where they're kind enough to come in and take lists of folks that have needs and sizes and, desires of a sweater or pajamas. And so we partner in that way, but I'm sure there's more ways that we could expand that partnering that we haven't yet done.
Great job.
Thank you.
So I just wanted to ask, in terms of volunteering or advocacy, what can we do that would be helpful to you?
Well, you can reach out to myself and Sabina Kish, and whatever it is that you can offer, and let us know, and then maybe we can process that, brainstorm a little bit, and figure out how we can best work together.
And with advocacy, are there things that we should be speaking up for specifically, or just the program in general?
Well, if anybody has any connection with the Yellow Food Bank or resources for food banks, that would be a great start, because that's something that the consumers are missing, and it's been going on for a while now. Thankfully, people still keep coming. It wasn't just for the food, but it was really helpful for the folks on these limited incomes and shoestring budgets to help tide them over.
Can you explain what, and I may have missed, I'm sorry, what happened with the partnership with the food bank?
We used to have an outside provider for our FSP services, as you may know, contractor cooperative, and that contractor, as well as the previous FSP contractors, whether it was Turning Point or I'm slipping on the other one right now, forgive me. Thank you. Telecare, which we had 2 iterations of, used to be Strides, then it was the latest Telecare. They all followed that model. We had them as a nonprofit having a connection contract with the food bank when the most recent Hope Cooperative regime, so to speak, came to look at the way things were, being done with the previous model. They sort of put their foot down and decided that they no longer wanted to move forward with that. And my understanding, peripheral understanding, is the county is not able to directly contract or get food from the food bank. It always needs to be an intermediary sort of nonprofit agency, and we're missing that at the moment.
So it's not about the food bank. It's about, the issue isn't with the food bank. I mean, if you had a nonprofit that could.
Well, yes and no. At the moment, it is the food bank, because we did have a nonprofit individual agency that wanted to help with this and started to help with this. But then my understanding is the food bank realized that there was a connection with the county, and that stopped things there.
And the reason why I'm asking is because in Davis, there's a very large active service club called the Odd Fellows. And the Odd Fellows is not as well known as Rotary, but it's been around Davis for a long, long time, and they own like a block in downtown Davis, from many, many, many years ago. And just real quick history, I don't want to take too much time, but 12 years ago, there were like 7 older men that would sit around and not do much. And then they started to bring in more people, and then they brought in Dave Rosenberg, who needed a new hobby because he was a judge and couldn't be involved in as many political things. And he was a judge here for many years, retired, still sits. And he and some other people grew that organization to be the largest in the country, even bigger than San Francisco. And I'm a member, it's a great group of people that just want to do public service. And I bet you if two things. One, you asked about volunteering, but then 2, they could be maybe that intermediary group to help with the food bank. And what I am going to suggest, they have a meeting every twice a month, once on a Wednesday evening, once on a Saturday morning. I think the Saturday morning is probably the more well attended because they serve food, breakfast. But if you or someone or Sabina or someone, I could talk to people over there, and if you wanted to do like a 15-minute presentation and then engage them and see where it goes from there, I bet you there are a lot of people there, and there are a lot of people that want to help, and a lot, I'm sure, that are interested in this area, and I think you might find some help if you do that.
Thank you, that sounds great. I think that I may have known one of those 7 elderly gentlemen. He's unfortunately passed on now, but his name was Martin, Argentinian individual. He was in his 80s, but I'm not sure if he was one of them, or you may know him, John. I have known him.
Yeah, but you have my contact number, or you can find it?
I probably do. I can maybe get it through Tony if I don't.
Yeah.
That's a great idea.
Yeah, it's a great
Thank
idea,
you.
John.
Okay, it looks like no more questions. All right. Thank you very much.
Thank you all.
And I guess I wanted to perhaps it would be worth having maybe even Tony talk to the director of the food bank, because saying there's a connection to the county isn't the same thing as saying there's a connection to people who have needs and aren't often don't have transportation and aren't mobile enough to get to the food bank.
Yes.
And is that Joy Cohen? Is Joy Cohen still,
I don't know the individual over there. Apologize for that.
All right, so I guess we're moving on to the budget then.
Sorry.
Sorry, you have a question?
Yeah, no, sorry, quickly. So, and other organizations that are local, stop me if you've already heard this before, but, the Davis Night Market, so like the free food at the farmer's market, not farmer's market, the Central Park area every night at 9 p.m. So that organization already collects food from businesses and distributes it to the community, so they're another food source that's not the food bank, and then also Food Not Bombs, I'm not sure the status of that organization, but I know they kind of did a bunch of kind of more community food distribution, it's like outside of big organizations, and they might be interested in helping out.
Great, thank you.
Budget.
I think we have one more question for you quickly. We're just gonna sneak one inside.
I
Sue.
was just going to, thank you for your reminders. I was gonna ask about tribal government, DK. I know that they have a lot of community work, and I wonder if they might have a food program, a food distribution program, but more locally, I know in West Sacramento, there's a local church, they have an awesome food ministry program. And so I have to wonder if even partnering with them might be useful or beneficial to the program.
Yes, what is the name?
It's a Presbyterian church there on, I can find out the name for you.
Okay. That would be great, thank you.
Just to add on to that, each of the cities may have different organizations, faith organizations that work together that might be able to support this. And I'm figuring that out might be, a way around it. I know that at the old shelter, different groups used to volunteer, prepare dinner for the people that were there as volunteers and bring the food. Something like that might be able to be done to do hot meals at the wellness center. That would attract more individuals. This is an idea.
Thank you. Just to add to that, the food is the necessity to give to clients, but our peers are ServSafe certified. So they are the folks that prepare the meals, serve the meals for the consumers that come in.
Can they use additional volunteers to help them?
I would imagine, the more the merrier. However, if they're serving food, they would need to go through this brief training thing and become certified to be able to handle food, serve food, cook food.
Okay. Thank you.
And I do have one more question. Do you guys take donations like for clothing and shoes and that kind of thing?
Oh, I should have mentioned that. We do have a clothing closet for folks that come in need. So absolutely, we all try and donate, whether it be things of that nature, clothing, or just cans, because we also take the cans for recycling and use that as a way to fund some of the activities and things like that for the wellness centers.
Where's that at? The clothing center?
Oh, it's just within our wellness centers, we have,
All free?
yeah, well, a little bit bigger here in Woodland, but yeah, we can get stuff over from the main Woodland hub over to the other centers.
I just remembered the name of that faith-based group. It's Trinity Presbyterian Church.
Okay.
But in looking up that, I was wondering about hygiene packets. Does your adult wellness center, any of them, offer any hygiene packets? Not to add on to what you guys already do.
We do. That's a great question, and a lot of the unhoused folks and other consumers benefit from that. But yes, we do get hygiene kits and put hygiene kits together from various pieces, individual things, and have those for folks that are in need.
Does anyone else have any questions or comments? Thank you.
Thank you.
Budget.
Yes. Again, I'm Tony Felder. I'm the Behavioral Health Director, or the Interim Behavioral Health Director. It's not official yet. I think there's like a board, there's like a something has to happen. Yeah, take back the cupcakes. So as Supervisor Farrick stated earlier, the board signed off on the county's budget at the board meeting on September 23rd, I believe. The only part that's unresolved with behavioral health is the MHSA budget, and it's in the director's report, item number B. As you all know, we are well behind schedule on getting the MHSA plan update completed. It was due on June 30th, and now we're out here into October. Last year, we were in a similar situation. I believe it wasn't approved till December. And the piece that's hanging us up is the budget, right? And as you have all heard me talk about several times, when we were doing some of the work earlier in the year, we had identified that there was an $11 million structural deficit. We had $26 million of anticipated expenses, only $15 million of revenue. We do have $11 million of fund balance. We can move the furniture around, as I like to say, and cover all the expenses this year, but we would completely exhaust our fund balance. So we provided this information to the board in June. We said, hey, go back and see what you can do, and also come back to us with some more information. Over the course of the next 3 months, there was some additional moving around of the furniture, which included bringing in FSP services in-house versus having Hope Cooperative provide those services, and a few other different funding shifts and some reductions in overhead expenses that helped us to reduce the $11 million structural deficit down to $4 million.
Wow.
Yeah. So we went back to the board on September 9th, and we explained, we provided an update. So we said, hey, here is the revised figures that we have. We have a $4 million structural deficit that's anticipated to grow to $5 million in fiscal year 26-27, just because of inflation and a few other things that we're anticipating will happen. And then there's some complicating factors with MHSA becoming BHSA, and the requirement to use 30% of the funding for the housing, right? So we provided a couple of different options for the board to consider to reduce the $4 million structural deficit completely. The first proposal looked at reducing some of the contracts, including the K-12 school partnership, the Woodland Community College partnership, the NAMI YOLO contract, and the contract for the First 5 Help Me Grow program. And the second option that the board was asked to consider was approximately $2.4 million reduction. Let me go back. The contracts, the total amount of contracts that were more than just the ones I identified, but those were the main contracts. The total reduction was somewhere in the neighborhood of $1.6 million to those contracts. The second option that the board was asked to consider was approximately $2.4 million of internal reductions to internal HHSA programming. And then the third option, which was the recommendation to the board by the department, was both of them, to take both of those together and completely eliminate the $4 million deficit. In the report, there was some inadvertent data errors that were the fault of Tony Kildare. And what had happened was I had taken information that is going to be included in the fiscal year 25-26 MHSA annual update, but I did not realize that data was not for fiscal year 24-25. It's actually for fiscal year 23-24, and it's because the data tends to lag a year because you're training in a report on June. And so there were several groups who noticed, like, hey, some of this data doesn't look right, including, well, I won't name them, but they called me out, let me tell you that. So I had to own that, and I have publicly, and I regret that it has caused consternation for some, and I will say, in particular, NAMI YOLO, right, who regrettably apparently received some phone calls saying, hey, wait a minute, we thought that, we were funding more than this, right? And so with that in mind, the board did ask for updated data. And so we were supposed to go back to the board on October 7th, but that has been pushed out to October 21st. So we will be presenting again to the board next Tuesday with updated information, quite a bit of data, right? Like a lot more data on all of the different programs that could potentially be impacted, including all of the different contracts that are part of the K-12 School Partnership, NAMI YOLO, Help Me Grow, all of our internal programs that might be potentially impacted. And then we will be asking the board to provide us some guidance on how to proceed with that. And then once that decision has been made, then we'll have a much clearer picture about where we're going to be in terms of some finalizing our budget and staffing. What I can say is that we've had with the county's general contracting process, we have had some positions that were unfunded or eliminated, right? So, for example, Mario, who just did a great job talking about the work that his team is doing, he's doing some of that work with fewer staff than he had in January. And we have a number of positions that remain unfilled that we're kind of holding until we have a better idea about where we're at, because we don't want to, we're making every effort not to lay off internal staff. But we anticipate that we're probably going to lose some internal positions. The county's budget also is creating a scenario where departments are being asked to hold a certain vacancy rate, right, in terms of salary savings. And so that's creating some additional pressure on filling staff. But we should have a much clearer picture about where I hope, that the board will be willing to provide us some guidance on next Tuesday, right? We should have a much clearer picture at that time. I'll pause now in case you guys have any questions about any of that.
Is the correct data that you have now?
Yes.
Is it better situation?
I'm
or worse?
I'm gonna be honest with you, it's a lot to try to digest, right? And it's kind of difficult, in my opinion at least, it's an apples to orange comparison, right? I mean, I think that, I guess it is what it is, right? I think that it's gonna be very challenging to say, oh, wait, here's the program that is underperforming, right? I think that for the most part, I'll be perfectly honest with you, the K-12 School Partnerships has been very successful, right? The Help Me Grow has been phenomenally successful, right? I mean, they have great data. And NAMI YOLO also has like a lot of data to support that they're doing a lot of work that is impacting the community. So I don't think that there's any particular program that is going to stand out and say, well, why are we funding that? But it's a much more robust data set than what we provided to the board on September 9th.
Tony, I'm sorry, my brain.
Oh, that's all right. I also have one.
So the inadvertent error misrepresented the projected allotted funding that we would have to cover the services you said for 25-26.
No, I apologize. We were asked to provide data to the board to help inform their decision, right? And so I thought that I was providing the board with fiscal year 24-25 data, but I provided them with data for fiscal year 23-24, right? And the reason was because I was pulling data out of the report that will be for the annual update for 25-26, and I just didn't realize that that data was just a year behind.
Okay.
So it was enough though that some of the providers were like, hey, wait a minute, this doesn't look right, and then it caused the board to go, well, wait a minute, if this data is not accurate, we're not ready to make a decision yet. Understandably.
I think people looked at that data and they were just flabbergasted because the numbers were low.
Mm-hmm.
And some of us said, this can't be right. These numbers are so low.
Mm-hmm.
And sure enough, Yolo and Amy said, yes, they are low and they aren't close to being accurate. And now they are accurate, so that'll be helpful.
And that doesn't affect the 4 million that you were able to dwindle the,
So just to make sure we're all on the same page, right? So there's, the data is the data for the programs that are basically being put out there, like these are areas where you could potentially make budget reductions, right, to address the deficit.
So it's performance data. What are they doing?
Yeah, how many clients are they serving? How many groups are they
It's
running,
not-
right?
It's not your income, that's,
No,
doesn't change.
yeah, and so basically, the decision for the board, the board's decision essentially is going to be, do we fully fund these programs for fiscal year 25, 26? And then figure it out in fiscal year 26, 27? Do we do a partial reduction to the funding this year, or do we completely eliminate the funding? If the board were to choose to fully fund these programs, then it would eat into the fund balance. And Supervisor Frerichs spoke to earlier, the board does not want to completely eliminate the fund balance. Now, when we first went to them in June, if everything would have been fully funded, they would have completely eliminated fund balance, and we would have been going into 26, 27 with programming that would have set us up for somewhere between $11 to $15 million deficit, right? If they were to completely fund everything now, they would exhaust about $4 million of the $11 million fund balance, right? But then we would be going into the next fiscal year looking at somewhere between $5 to $8 million deficit. So, I mean, the board just really needs to make a decision about how they want to approach that, right? Do they want to fully fund the programs, or do they want to address the deficit now? I hope that was possible to follow, and if it wasn't, please let me know.
Well, I just wanted to ask you, because didn't they also shifted money around, that they just sort of had pots of money that were sort of stranded that they brought in to cover this, right?
So what I can say is that my understanding of what they identified in other funds that we were able to come to bring in to address some of this, it's not enough to address all of it, right? I think it's going to help, but I don't think that it's going to completely address the entire $4 million deficit.
But that does mean that they can shift money over from other places. Are they considering that?
I can't speak to what the board is considering, right, but I do believe that there have been some recommendations around some specific funding through one-time projects that were funded with what was formerly known as ARPA dollars, right? They kind of rebranded them, called them county-specific projects or something like that. And so some of those dollars, I believe, have been freed up to help to address this deficit.
I'm just marveling at 4 years ago, our fund balances were so embarrassingly large that we were afraid the state was going to take money away from us.
I mean, that's part of what fueled Prop 1, to be honest with you.
I know.
It wasn't just Yolo County.
I know.
But-
And that's,
But the challenge is that you're kind of like on a yo-yo with the funding, right?
it's a moving target.
Well, it's just, you have times when you have all of this funding, and then if you try to spend it all at once, right, then you have to stand up all this programming, and then the next year you don't, right? And I think that this is sort of the consequences of that,
Yeah.
right? There was a lot of pressure, understandably, from the community about
Right.
like, hey, why aren't you spending the money?
And we couldn't spend a lot of it that we had allocated because of COVID. I mean, people weren't coming out to public events, and, it was a much more difficult time to figure out how to do the kind of programming you need to do in mental health.
Yeah, I mean, and I also think that $11 million of fund balance isn't nothing, right? I mean, it's still, a fairly sizable fund balance, right? Just the the costs have gone up quite a bit, right? And that the programming that has been allocated to the MHSA budget has
Right.
gone up quite a bit, right? And so, we were looking at $26 million earlier in the year, right?
And the problem is that it's a rainy day fund, but we don't know if it's gonna continue to rain.
I don't know if I would call it a rainy day fund. I mean, the nature of the fund balances with MHSA is like, as you receive each year's allocation, if you don't spend it, you're gonna revert it. The state will take it,
Yes,
right? And so even having that $11 million fund balance, we're gonna have to find a way to spend it sooner or later as well.
yes.
I think that where we're at as a county is when we're looking at situations like this, where we're upside down, right? In the sense that we have much more budgeted expenses than we do revenue, right? And we don't want to continue. And so we want to try to correct that going into the next fiscal year. So I don't know. I mean, it's just terrible timing in the sense that I think that there was a lot of good work that was done back when there was
Right.
embarrassingly high fund balances to stand up programming and do good things, and now the bottom's sort of dropping out. With all that being said, we are and we can talk about this later too. We're starting to move forward with the Behavioral Health Service Act budget process, right? Which is going to be much more extensive,
Yes.
right? So the Mental Health Service Act budget process really only involves how we're spending the Mental Health Service Act dollars. The Behavioral Health Service Act is going to require us to identify all of the funding, right? And so we're already starting to work on that because we're going to have a very tight timeline to get that whole plan put together. We probably need to have it together sometime in December in order to meet the deadline of March. So we actually have a staff who has been assigned to project manage this because we're going to have to get a lot done here in the next 8 to 12 weeks.
So the Board of Supervisors basically have to make a decision to cut the already funded programs.
They have to make a decision if they want to cut it, or they have to provide us guidance on what should be funded or not funded.
But if you don't fund everything, you go into 26, 27 with the zero deficit, with the zero fund balance.
I mean, they could fund everything, and we would, if they funded everything that's in the budget currently, right, everything that's currently budgeted, then they would exhaust approximately $4 million of the fund balance. We'd still have $7 million.
Oh, I see.
Right. But then we would, and again, there's a lot of assumptions that are being made here, right? But assuming that we got a similar allocation this year, assuming we got a similar allocation to this year, next year, then we would have another structural deficit.
Which could lead to more cuts.
Which would eventually we'd have to figure it out, right? I mean, so if we got $15 million again for fiscal year 26, 27, we'd have $19 to $20 million of projected expenses right off the top, right? And so we would automatically start off with the structural deficit. And so the board, has to make a decision about, do we want to address that structural deficit now, or do we want to deal with it later? Or do we want to just get through this year and then make some decisions about what we want to do with some of these contracts in the next this year? Because as we're going through the planning process for the BHSA, for the Behavioral Health Services Act, we have an opportunity to reimagine the entire plan, right? That the existing plan is extremely complex. I mean, it is very complex, and the budgeting for it is just really very, very challenging, right? And so I'm hoping that when this is the last year of the MHSA process, I'm hoping we can wrap it up and then basically start over with the Behavioral Health Service Act and have a process or a plan that is a lot simpler.
Okay, I just want to say that I've been failing in my chair duties. We're going way over.
Sorry.
Not your fault. Does anybody have any last quick questions before we move on to the next thing? Okay.
And I'm gonna have to excuse myself. I have another meeting tonight. And so having moved it to the third
Sorry
Wednesday
about
put
that.
me in a bind.
So, yeah, so we're good because we were two up.
Okay, so moving on to public comment. This is the public comment where if you want to hear about something in the director's report, you should mention that in your public comment so that somebody can ask for Tony to speak on it.
I'd like to make a comment or a few questions and comments. First, I'd like to thank Christina for inviting me. I was at the front door. I just left the Wellness Center right there. And I'd like to thank Mario for clarifying the question that I had, which is the differences between clubhouse model and the clinic. And so that was pretty resourceful for me and informational. Let's see here. Question, comment. I'm not certified or college educated at mental health counseling, but I've had several years of CDC California Department of Correction, dealing with mental health inmates, quelling situations, but I'd like to volunteer my services at the clinic, if anything, if any kind of events ever happen, that are amongst the clients. And, let's see. I have been a client of this wellness center, but I just dropped in today again. I've been there a couple times. But I've motivated myself to go in again and then figure out and find out the resources for some, problems that I have in my life. And I have an appointment tomorrow with the case manager, Lisa. And hopefully I can, benefit from it. And I want to thank all of the PHS members for doing what you do for everybody. And I am homeless. I've been homeless for a year. And I had a stroke in 2020 due to high blood pressure. And it's very difficult for me. But I managed to go through it. And I'll be there tomorrow. Thank you.
All right, thank you very much for sharing that.
You're welcome.
Is there anybody else in the room or online who would like to speak? Is anybody online, Christine?
I don't see any hands raised.
Okay, then we'll move on to the director's report.
You want me to go through sorry, you want to go through the whole thing or do you want to pull
Sorry.
items? Okay.
Thank you. So who would like to pull an item?
Bye.
E.
Just E and I? Okay.
If you say, did we get to O too?
That's up to you.
Okay. Okay. All right, adult full service partnership update. What I can tell you is you're continuing.
So I just had one more narrow question.
Oh, yeah.
So I'm not, so when you say initial number of FSP clients, what does that mean? Initial number?
That was the number of clients that we were, at the time that Hope Cooperative ended their contract, there were 207 open, there were 207 FSP clients open to them. When we brought the program internally, we only have capacity for 100 clients. And so we made a decision not to, because the entire system of care was supporting all these clients, and there was a lot of anxiety from the clients that were being served about whether or not they were going to continue to be recognized as FSP clients. We made a decision not to just arbitrarily strip away anyone's FSP status. However, there have been a number of clients who were ready to step down to a lower level of care. And we also have had some clients that we lost contact with, and then there were also there were some like cases that we inherited that were actually ready to be closed, right? And we just had inherited it. So the initial number was 207. We are currently serving 164 individuals that we're identifying as FSP clients, with the goal of getting down to 100 at some point for the FSP program to be serving those clients specifically.
Because my recollection, if that's a great point about the word serving, because, you know, talking to Carlene, Hope Cooperative was not doing a very good job of taking those that were, that they lost contact with off the rolls. So they really weren't serving 207. There were quite a few, or a number of them that they actually weren't serving. They just weren't taking them off the rolls.
There were some individuals who were identified as FSP clients who were ready, but like the case was essentially ready to be closed. That's correct.
Yeah, partly because they had no contact with them.
There were some individuals we were not able to make contact with. That's correct.
What about, I know it seemed to me that the group of people that were kind of not getting, my recollection is getting some short shrift because of all this were the TAY population. Can you talk a little bit about that? How is that? Is that going okay with that population?
To the best of my knowledge, the individuals who identified in the TAY population, we captured adequately. So we have a children's team who's able to coordinate and to reach out to any individuals who were in the TAY age range and try to connect them to the children's system of care specifically. And so
I think you need to explain what for everyone.
Sorry,
We had
Mark.
a TAY team, as a transitional age youth. It was up to
Yeah.
age 25. Before the private contract with Hope Cooperative and Telecare, the county had a TAY team, which provided FSP level services to that age group, specifically specialized in that age group. And when the contract, those services were contracted out, that TAY team was shut down, and those individuals 18 to 25 were pushed to one of the two contractors to then consolidate with Hope Cooperative. So that's kind of the background, what the TAY team is and how that transition occurred.
Yeah, so Jonathan, I'm going to make an assumption here about what you're getting after, right? So, and just to get to Chris's point, that the TAY, the transitional age youth age range is technically specified as ages 16 to 25. So from their 16th birthday all the way up to their 26th birthday. And to Chris's point, we had an internal TAY team that was serving that age group specifically. And so when we contracted the services out, the most recent time we contracted the services out through two contracts with Telecare and with Hope Cooperative, there was supposed to be a designated number of TAY slots, right? And I think that what, Jonathan, you're getting after is that it never really, it didn't seem like it ever really got there, right? That we were mostly serving adults and older adults, and we weren't really serving the same number of TAY transitional age youth as we had intended when the contract started. And to your point, I believe that when the contract ended, we didn't really have like a sizable TAY population that was being served by Hope Cooperative. We have made every effort with the individuals that are in that age group for the children's team or for someone to really make sure that they're being, because it is sort of a special subset of the FSP population. But we're still working on that. I know there's going to be some other questions, right? But one of the biggest challenges that we're currently having right now, right, with this transition is the 92 permanent supportive housing slots, right? So we have 3 different housing sites at West Capitol in West Sacramento, across the street here and down the road here at the tiny homes, right? And between the three sites, there are 92 units that are identified as permanent supportive housing units. And part of the process of getting the the loans for capital development to stand up those projects included the county basically making a 30-year, 20 or 30-year commitment, depending on the project, right? To provide full service partnership services to each of those clients, right? So, and our housing partners are definitely reminding us of those responsibilities, right? So we have, capacity in the program that we're trying to build for 100 FSP individuals, right? But 92 of them are going to be permanent supported housing clients, right? And so we're working through some of that with our housing partners, right, about how that's going to work, right? Because we do have some individuals who are in those units who may not necessarily, meet necessity for full service partnership services, but we're required to at least offer them to them. What's happening is at those 3 specific sites, they have a tremendous need for case management. And they are, our housing partners would like for us to provide somewhere in the neighborhood of one staff to 10 to 14 client ratio. But the program that's been set up only has 4 case managers, right, in the budget, which is not even enough for, the West Capitol site, right? And so we've been doing our best to make sure that we have at least 1 case manager at each site daily, but it's not enough to meet the demand, right? And so it's becoming a problem. It's creating some tension with our relationship with the housing partners who have been very understanding, right, about our situation, but who are pretty insistent that the county had taken on more responsibility than what we're currently taking on responsibility to provide more services than what we're currently providing to them. So that is a huge challenge for us in standing up these full service partnership services, right? Because there are other programs that are going to need full service partnership level of care. So, I was just at the CARE Act convening today in Sacramento, right? Where a lot of the other counties are talking about, the individuals who are being served by CARE Court are automatically going into like an FSP level of care, right? And we have other, of our mental health courts and other things that we're going to try to be doing, and we're going to need to have FSP slots for those individuals as well, which means we're going to have to invest more resources into FSP than just 100 slots, right? We do currently have 30 slots through the mental health court, but 130 slots isn't going to do it. We have a children's program too that is serving, I think, 20 youth who are ages 0 to 18. But what I'm looking at in fiscal year 26-27 as we go into the BHSA is that we're going to have to make a large investment in FSP services, because we already, with the program that we're trying to stand up to serve 100 clients, it's not even enough barely to serve our individuals who are in permanent supported housing. Sorry, that was maybe more than you asked for, but okay.
So the 100 slots, does that include?
I'm on top of it, man.
Does that include the 30 from mental health court at this point, or not?
Say that one more time?
The 100 slots you say?
No, that does not include the 30 from mental health.
So it's the 100 plus 30.
Yeah, 100 plus the 30, yeah.
My second comment about the 92 slots going into the housing, which is, it's apartment style housing, is that I repeatedly saw Hope Cooperative putting individuals from a room and board and a board and care where they were being successful into an apartment in the Mercy housing in West Sacramento, where methamphetamine was rampant, where they were addicts, and you watch them destabilize, commit new crimes, come back to court, be incompetent to stand trial under Penal Code Section 1368, be sent to the state hospital again. And so I have a concern that seeing that doesn't happen again. What also happened is those individuals were evicted from that housing. So now they have an eviction on their record, which makes it more difficult to house them in the future. So it's a vicious cycle because of the pressure to fill those 92 slots that Hope Cooperative had. They put people in those slots that weren't ready. And it was a disaster for a number of them. And I'm hoping that we're not going to be repeating that, or we have a better way of doing that. Because an eviction on a person's record who's an FSP level client makes it much more difficult to house.
Yeah, I mean, I'm reluctant to be critical of Hope Cooperative, right? And I'll let other people hit that.
I'll just
Yeah,
clarify.
I'll just start there,
No,
right?
I told them that's gonna be a bad idea for these individuals, and the response I got was, well, that's their right to go there. So if you dangle a nice apartment in front of someone versus having a roommate in a board and care, of course they're gonna wanna go into that apartment, but they couldn't handle it, and they weren't able to be successfully managed, and so it fell apart for them. And I'll be critical because I saw that, and that's what's happened in a number of cases.
So what I can say is that we are getting a lot of complaints and feedback about the 3 different sites, and that there are concerning situations happening at them, right? You know, to your point, right? And that there is a, I mean, I trust our partners. I trust our housing partners, right? And I trust the local law enforcement who are saying that we need a greater presence at those sites, right? We don't currently have staffing to achieve that, right? And so that is something that we're going to need to be moving towards in the future, right? Again, you know, what we're looking at is a situation where we've had a number of vacancies. Like, so again, to Mario, who's here, he has a lot of vacancies in the front door, right? You have, you know, with people coming in seeking services, and people who want to engage in wellness center activities. And so there's different areas as the director where I'm trying to figure out, okay, when we do have an opportunity to fill these vacancies, where do we start, right? For the full service partnership program that we're trying to stand up, to your point, right? I don't believe that the situation in some of these housing sites is any better than what you experienced before. That would be my assessment of that, right? That there are still the same kind of concerns at those sites, and that's what our housing partners are asking us to help provide them some support to address.
Okay, I think a bigger point was, if they're not ready to manage or succeed in that environment, let's not put them in that environment if we can avoid it, just because we have to fill those slots. I saw one of the individuals that was put in one of those apartments outside the CVS last week, walked around in shorts and socks and no shoes, talking to himself.
Mm-hmm.
And he was incarcerated for a long time, was at a state hospital, he was stabilized with a serious meth issue, and then he got put in that location where meth is in the water, it's in the air, it's everywhere. And now he's deteriorated, probably with an eviction on his record now, wandering around the streets of Davis. And there's probably others in the other jurisdictions. That's why I bring that up. I'm passionate about it because you can see the train wreck leaving the station, and I just don't want to see any more of those.
Can be avoided.
Let me say, Chris, I share your concern. And one of the things that when the county had FSP services, Laura was over Tay, I was over adult and older adult, and the first housing project came across the street. We did pick and choose wisely with folks that weren't just like completely primitive and not had any sort of housing first. However, it became more and more complicated because there was units that needed to be filled, and there's constant pressure from the partners to fill the unit, and that's a challenge. But I think also it wasn't happening with the contractors, whether it be Hope or Telecare, is the intensive case management that really needed to happen around housing to be able to have these individuals learn how to have independent living skills to be able to be successful. Instead, things were thrown at them, such as a house cleaner, they don't have this, okay, let's buy that. They broke this, let's buy, as opposed to having some sort of groups, housing groups, things along those lines, and intensive wraparound case management when they're in there. So the hope is that our internal services, as they once were, will continue to do that have that sort of dynamic. There's a lot more care and oversight I feel from our internal services. We know some of these folks, a lot of them are new, but some of them we've known for years. And maybe some of these folks are offspring of some of those folks that we've worked with in the past. So there's hope without hope in that our internal teams will do a much better job.
What I can say, and I thank you, Mario, for pointing that out, right, is a couple things. First of all, I'm not trying to say this is an insurmountable problem, right? I'm just being transparent and honest about where we're at, right? We have every intention of getting to the right spot, right? And I agree that when the county has had the full service partnerships services in-house, we've been able to do it much better than we have with contractors in the past. It's debatable, don't get me wrong, because we have some people who love one version over the other. But we've received a lot of feedback from the community in the past that there is a preference for the county to be providing the services, right? And I believe that we can do it. We are committed to getting there. I think what Mario is speaking to is that there seemed to be like a difference of philosophy about how to approach working with clients to be self-reliant, right? That is the philosophy we're taking. And to be perfectly honest with you, I would like to shift the conversation about what the permanent supportive housing looks like, right? Because, and you guys have heard me talk about this before, right? Like we end up with 92 individuals. If we can stabilize them, then it's just 92 individuals who are using that resource in perpetuity, right? Which I don't think makes sense, right? And so, I would like to see Yolo County get to a place where we have 92 units that have the most intensive case management, right, possible, right? And then another level of care, right, for individuals to live independently to step down to, right? And then permanent supportive housing doesn't look like we get these 92 people and get them stable and now they're gonna live forever, right, in that situation. So, I mean, it's a vision that is like a ways out, right? And I don't want to take a decade to get there, right? But that is where we want to get to, I think, right?
That's a great idea. I don't want to, I've seen the Department of State Hospital program with the county staff providing services to the population is probably more challenging than the FSP population and be very successful. So I believe the county can do it. My concern is people going into that housing that aren't ready for it.
And we might have that going on for a while longer, you know what I mean? Right? Where we're at right now, that we will try our best to avoid it, right? But that may happen for a while. The other thing when we can move on to I when you're ready, but the other thing I will say is that our partners have told us that we're more responsive, right? That, even with all of the challenges we're having, that they're grateful, right? And that they feel like we're more responsive than what they're getting a better response from us than they were getting from the most recent contractor. And so, I mean, we are making progress.
I can vouch for that from personal experience with my loved one.
Thank you. Go get a cupcake.
Thank you.
I think you can have two.
We're getting very tight on time now. Bruce, what was your question about why?
Very, the explore potential placement options, assuming that Has any counties developed a lock facility for the new standard?
I don't know the answer to that, but I do know that there is a facility in Sacramento that just sent me an email again earlier this week, right? That I've been out to and seeing that would be appropriate. So it's a lock facility that could serve SB 43 clients, right? They can provide substance use disorder services. They can actually provide services for Murphy clients. And, we would like to be able to get into a contract with them. It's just about locating funding at this point.
So that's gonna be very expensive.
Yeah, so we're trying to do an analysis, about the other expenses that we have in place people in other parts of the state as well, in terms of transportation and everything else that goes along with that. But yeah, it's gonna be a little bit more expensive, but I think it would be worth it for us to have something like that close to home.
But SB 43 clients most of them wouldn't need to be in a locked facility, would they? I mean, because they're just, in a sense, they are, people that you're conserving now are probably more ill than the people that you're adding with SB 43, because you're lowering the bar to get people conserved. And right now, most people conserved under the current law don't need to be in locked facilities. And they aren't in locked facilities, right?
We have all the gamut of levels, but if it's somebody who's placed on LPS as a result of SB 43 and they do meet the criteria for a locked facility, maybe they're duly diagnosed and they're somebody who won't maintain the facility, and they maybe end up at a locked facility, one of the crest words or something like this.
Yeah, so SB 43 should expand the number of people that are gonna need a locked facility, because they're expanding the definition for those who are eligible.
Just anecdotally, I've seen like substance use only clients in standard psych facilities. So that as in there is no mental health diagnosis, there's just a substance issue, and then they're in the same location.
To Jonathan's point, I don't think that we're saying that just by virtue of the fact that someone would be a client because of SB 43 that they would need to be in a locked facility, right? However, we're anticipating that we're gonna need, some, and then we just need, even outside of SB 43, right? There are gonna be times when we need to place an individual in a locked facility, and it would be better for us if we could place them closer to home, right? It'd be better for the individual, it'd be better for their family, right? And so there's a specific facility in Sacramento that we are looking at, right? But as far as SB 43 goes, we are, we're working to be ready for the deadline. Our behavioral health and public guardian, we have staff who are assigned to kind of getting things ready. Our public guardian wanted to make sure that I mentioned that we're going to be scheduling a virtual stakeholders meeting, and we'll provide you all with the date and time. We're looking at mid-November at some point in the early evening, and we'll keep you updated about that.
Okay, let's move on. Board of Supervisors report. Supervisor Stark spoke. Supervisor Villegas isn't here, is he? Christina, I can't see who's on the screen.
He did his report first, or earlier before he left.
No, I was saying
Villegas.
Supervisor
Oh, no,
Villegas.
there's no other supervisor.
Okay, I didn't know if he had sent anyone or
Nope,
anything.
that's
Okay, ad hoc committee report, site visit planning, if he is not here, did anybody want to say anything about it? She mentioned that you were still working on documents.
I guess the latest update would be that Nithya edited and updated the document, and then D&I reviewed it. And then that's kind of all the updates that we have.
Great. Perfect. Okay, annual report. Oh, sorry.
As far as the site visit, there's also, we can do a tour of Walter's house. That would be a Monday, Wednesday, or Friday, either 9:30 or 1:30. Send out an email, see who's interested and what times work. And it would be a tour, not a site visit, just for to see what the residential facility looks like.
Thank you, Chris. Okay, on to the annual report by our committee.
So I completed an outline of the annual report and I provided that to the executive committee to review. I plan to have a more detailed draft available by sometime in November, and I was gonna send it to Christina to have the board review prior to our December meeting. I also consulted with a board member, behavioral health board member from Napa and from San Francisco who were heavily involved in the process of drafting their annual report to develop more context on their process and how we could kind of replicate that in making our annual report. And they had a bunch of pretty helpful tips that I used in creating the outline.
Are those reports public?
Yeah, so you go on the California Association of Local Behavioral Health Boards website, and then the recent ones are listed. You have to do some digging within the website, but then all the recent ones are listed. And I dug so far into the website, I started to find errors and emailing to your director. So that's the updates I have regarding the annual report.
Okay, great. We have one last public comment. Anything from the room?
Of course, I have some.
Okay.
So I have a comment on the tiny homes. My last job before my stroke in 2020, my second to last, and I worked for CM, they built the tiny homes. And unfortunately, the contract with, I guess, the county, they had to lay off a lot of people because they weren't building anymore. And I know that if there were a budget, they had the budget to build more, there'd be more job opportunity here and probably a little bit less public homelessness. I know that.
Okay, thank you. Is there anyone online who wanted to make a public comment? Okay, I think we're good. I think we're ready to adjourn.
Yay, Sue. Good job, Sue.
Great job, Sue. Good job.
Yes, yes.
Something new, what happened?
My central office is on the property. So it's
Oh,
like.
I'll collect them all and put them in the box.
Like I'm not always like. always in the- it's a little larger than my desk, like, I have to write down. So, just. Everybody can do this for a minute.
Thank you for the cupcakes.
For my